Welcome back to the Morning Blend. Well, if someone is particular, organized, or super detail-oriented, we might say, oh, you're so OCD. But obsessive-compulsive disorder is a real mental health problem. In fact, more than 2 million people struggle with it, and 1 in 3 say they first experienced symptoms before they were 14 years old. Today, we're going to talk about the symptoms, how it's treated, and a new program that uses an app on a smartphone to help relieve the stress and anxiety of OCD.
That's right. Dr. Brad Riemann is the clinical director of the OCD Center at Rogers Memorial Hospital. He's an expert on the assessment and treatment of OCD in children, teens, and adults. We're going to chat more. Thanks for being here, doctor.
Thank you. Good morning.
Good to see you.
I think this is great. I think it's a very flippant term that people use to describe something when that's not necessarily a diagnosed disorder, but OCD is truly a mental health disorder. Explain how you describe it to someone and what sort of qualifies as true OCD.
Sure. Well, OCD is characterized by obsessions and compulsions. Obsessions are these unwanted thoughts, images, or urges that generate high levels of anxiety. Common example might be the fear of becoming dirty or contaminated.
Germs.
People think of Howie Mandel with
Correct.
that.
With the hand washing.
Yeah. Doubting whether you did something or did something correctly. Did I lock the door? Did I turn off the stove? Compulsions, on the other hand, are some sort of repetitive act, something that someone does that can be observed, such as perhaps a hand wash or cleaning, or actually physically checking to make sure a door is locked.
Turning lights on and off.
Turning
I've heard
lights
that, counting.
on and off. Yep, yeah. Or something that can be done even silently in one's own mind. So it can be another thought. So it might be a silent prayer or counting in one's own mind. And you know, someone has obsessive compulsive disorder when they're doing this to the point where it begins to interfere with their life.
That's a good point, because I just wanted to know if all of us have a little bit of that, because I think about, you know, like counting things, or people sometimes have specific number things. I do, but I wouldn't ever consider myself OCD.
Yeah, and some people do describe it as kind of a great exaggeration of the norm.
Yeah.
But it has to interfere with someone's life, either occupationally, academically, or in their relationships.
Okay.
What's fascinating about it is it's really not a personality quirk. It's not a character trait. It is, if you have true OCD, it's a reflection of a mental disorder. I know the good news is that we're talking about good news, bad news. The good news is it's a very treatable condition, and I think because it's an obsessive compulsive disorder week, it's important to make sure that people have that hope that it can be treated very often successfully.
Yeah, and that's what OCD Awareness Week is all about. I mean, it's really trying to increase public awareness about the condition, but also its effective treatment. And as you said, in the vast majority of cases, when treated properly, it can be treated.
How does treatment work? What kinds of things can someone look forward to if they feel like OCD really interferes with their life?
You know, there are medications that have been found to be helpful in reducing symptoms, but the treatment of choice for OCD is actually a type of therapy known as exposure and response prevention, or ERP. Basically, it in a very graduated fashion kind of reintroduces people into their feared situations or the things that they avoid, and as a result they begin to get their life back.
Yeah, and I think getting your life back, there's a sense of empowerment to that, and not necessarily control, but empowerment that gives people hope, because just medicating, I think, sometimes a problem. It seems like we're more likely to do that in today's society. It's wonderful to think that we can learn skills almost, or a new way of thinking. Let's talk a little bit about if someone thinks or they know someone that they think might have OCD, how do people get answers to their questions or find out more?
Well, I'm glad you asked, because actually locally next week we do have an Ask the Experts talk going on next Tuesday the 18th at 6:30 p.m. at Waukesha County Technical College. So myself and 2 of my colleagues from Rogers will be there to, you know, really discuss OCD and its treatment, but more importantly, answer questions. So we're really looking forward to that opportunity.
How about research? Where is that at in treating and just understanding OCD?
Yeah, well, the research that we have done at Rogers really focuses in on how to make treatment more effective and also how to make it more accessible. We've discussed that, you know, there is effective treatment, but sadly very few people have access to that. There are very few centers of excellence that treat OCD. So what we've really been trying to work on is how do we make it more effective and how do we make it more accessible. And one of the things that we've done is developed a computer program. And we've been researching this program probably for about 10 years. We've published scientific articles on its effectiveness, but historically it's all been on kind of desktop computers with big monitors. And those are becoming somewhat extinct.
Yeah, because everybody has it in the palm of their hand
these
days.
That's right. So we're kind of shrinking the program into an app and putting it on a handheld device, a smartphone.
Okay.
And we need to, of course, restudy it because we're changing the program and changing the size of it. But the idea is if we can find that this app is as effective as the bigger version, so to speak. This is not only going to help us treat people more effectively, but really dramatically increase the accessibility because, as you said, so many people have smartphones.
And this is exciting. I think people are going to wonder, is this in place of therapy or sort of a complement to therapy? And so it's also important to understand how and why it works, because it has this app, it's a program that sort of trains people's brains, right, away from the words that they find sort of threatening or like germs, like we talked about, but sort of trains them in a new way to kind of take their mind off of those obsessive thoughts and therefore hopefully stop the compulsive behaviors.
Yeah, people with OCD tell us that they kind of have their radar out and they're kind of scanning their environment for any little signs that kind of things that scare them or frighten them, and they think of this as almost a protective thing, that somehow this is going to help them. But unfortunately, it's exactly the opposite. It really kind of fuels their condition and makes their OCD worse. This computer program directly targets that and kind of shuts that radar down, trains their attention away from the things that they find threatening, and reduces OCD symptoms.
Wonderful. Can you ever use OCD to your benefit in terms of focusing on positive things and becoming a little obsessed with positive things that help you be a better person?
Yeah, I wish it were so. I don't think so. I mean, and this kind of gets back to what we were talking about, where everyone kind of focuses in on things and so forth. But I would think if we talk to people who have OCD, they would probably say that it really never can be something positive. Focus and attention is good, but this is again something really a great exaggeration of that to the point where it does interfere with their well-being and happiness.
What I think is wonderful is the intention to make it more accessible to people, because a lot of people who are suffering, it does interfere with their lives. And I think that's a wonderful thing about this. So we wanted to remind people too about the event that you just mentioned. It's a free event that's happening next week, October 18th at Waukesha County Technical College. Experts will be there to share more information about OCD, but also take your questions. You can find out more about that event by going to the website that we just had on your screen. To learn more about that event or expert care available at Rogers Memorial Hospital, because they're so close and have experts and wonderful programs there, what you can do is call the phone number that you see there. It's 414-865-2600, or send an email to researchstudies@rogershospital.org. Great to see you.
Yeah,
Thank you so much.
Thank you very much.